I think that really speaks to the benefit of integrated care,
Yep.
where if the person has to go off to some other building that's hidden
Right.
somewhere on a campus, or it's in a different neighborhood entirely, then a patient's going to be more reluctant than if you just can bring someone in to them,
Right.
or it's right next door. You're not having to separate these pieces off.
I was just at a research, listening to a research talk, and the people said we set it up right next door, and even that's not close enough.
Yeah,
So it really has to be
it's co-located, not
co-located.
integrated.
But I also think we have to be careful and flexible, right? Because I think there still are treatment systems that say, well, gee, even though it was right, we had this behavioralist in our clinic setting and you had an appointment yesterday and you didn't show up and now you're here for your buprenorphine, I can't possibly prescribe that to you now because you missed this, right? This idea of non-adherence being a new medical problem for this patient. Maybe they were at their housing or DCF appointment, which, they had to do some priority setting, which is actually a higher level of thinking. They're actually,
We want to encourage that.
we want to encourage that. And so I think this inflexibility that has perpetuated can be challenging. So whereas I think that medications and counseling can be incredibly powerful in many patients for substance use disorder treatment, I think as a system we have to be careful about being punitive if those things don't always line up with what we think it should look like, because patients may have different needs.
We need to offer patients treatment options.
Right.
But if patients don't want one treatment option, there are other options.
Right.
We're flexible.
We have to be flexible.
The problem is some of the rules don't allow that, and certainly the best case of that is methadone treatment, where when you start you have to come every day. And certainly there are people who have figured out that, if I get a dose to take home on the weekend, I can actually make that last for 3 days rather than 2. I don't have to come in on Monday. But there are some programs who would penalize people for being, that thoughtful, that careful, that creative with how they minimize the burden that the system has put on them. The provider hasn't put it on them, the system has. And so we need simplified, more humane systems for delivery of care.